Steps are an overview, and Dr. Nitin and Dr. Ranjit are going to speak much more about this. We always start treating people by assessing them and strengthening their healthy tissues. We set the terrain, we prepare the soil, it's called Kshetrikarana in Sanskrit, and then we assess the mind and make sure that the mind is strong, and we try to keep it positive. The mind is called manas, so mano, and bala is strength, so mano bala. And we strengthen the tissues that start with the mind and then go into the body, and that's called rasayana. So that nourishment is important before we start cleaning out things. So we keep the gut clean, or clean the gut out first, and then try to keep it clean and improve this digestive fire, so that anything that comes in, whether it's chemotherapy, whether it's food, or whether it's any other kind of medication, that the digestive fire can actually digest it and take it into the body and process it. We keep the body calm. That's called vata in Ayurveda. And keeping it calm is very important, because these aberrant flows, you might intend for something to go in this, vector direction, but if the flows are aberrant, then it's not going to reach the target. And so we keep the mind calm and the body calm. And then we begin the process of shodhana. So many times when patients are going to go through chemotherapy, we do the first 4 steps, so that as they get that poison or chemotherapy or radiotherapy or immunotherapy into their body, we're cleaning out the ama, the residual toxins that happen from that chemotherapy. And then we also focus on the attitude of having a wholesome life and preparing yourself. Any of us can die any day. And it's, there are people that have cancer. I just had dinner with a woman who's had cancer for 24 years. She's in remission. She says, the doctors told me I was going to die in 6 months. And that was 23 years ago. So I could die before she does without a diagnosis of cancer. So we try to focus people on living a wholesome life and keeping their mind and their body together and having a peaceful heart. And that's a very important part of the mind-body connection that is health. So these are some of the modalities of Ayurveda, and they begin with things that we know in conventional medicine: food, lifestyle, some fasting, movement, and exercise. These aren't always counseled by people, because people think that modern medicine especially thinks that, the treatment is really those medicines that you take in your mouth, the chemicals. The more complementary things that are in Ayurveda and also known in the modern mainstream world are meditation. Most people have heard of yoga, breath work, some massage, although massage isn't sometimes done with cancer patients. Aromatherapy, because it's non-ingested, so they say it's less side effect chances, and the use of sound medicine or sound therapy. And then this third section is things that we use specifically many times, depending on the site of the cancer, the stage of the cancer, the type of the cancer, and the patient herself or himself. And that is those rasayanas, which are rejuvenative. Sometimes some marma points that are not above a solid tumor, but in other parts of the body that tend to shift the energy, the whole energy of the body. the chemical medicines, plant medicines, which are herbal formulations in many different dosage forms, which we call Bhaishaja Kalpana. Kalpa means like the form that it's in Bhaishaja is the medicine, and that can be herbal, it can be animal, or it can be mineral. If they are mineral medicines, we call them bhasmas, and this is in orange because it's an important part of many people's cancer regimens, and we can talk about that a little bit. And then taking care of the five senses, maybe doing some oil-based treatment, although many cancer patients do not have the strength in their gut or in their mind or in their body tissues to have panchakarma. The daily and seasonal routines of the body. And then the last part is more what we call woo-woo, which is working on your relationship with the divine. Using mantra, which has a connotation of spiritualism, which is very important for many. And there was a study that showed that 97% of patients want their doctor, especially their oncologist, to pray with them. But these attitudes of people is part of individualized care. Jyotishi is influence of the larger rocks in our solitary system known as planets, and how that M1, M2 gravitational force affects us, and then gemstones, which are stones that we use for our body. I'm going to stop there with the introduction, and I'll come back to some of the other slides, but I wanted to give you that introduction so that you get a context in case you've never heard of Ayurveda, and start with questions with our two Ayurvedic oncologists, and ask, Dr. Nitin, could you talk a little about the Ayurvedic understanding of cancer based on your clinical practice? And then Dr. Ranjit.
Yeah, so thanks Dr. Baswati Bhattacharya, Dr. Manoj Reddy and IOWG for giving us an opportunity to interact with you. Now, understanding of cancer, 500 years before the Christ, Sushruta has described this cancer in the name of Arbudha. And you will be surprised, doctor, that there is a word called Arbudadnya. Today we have oncologists. The same word has been used. And what Sushruta said, that these are the signs and symptoms described by Arbudadnya, the one who is specialized in cancer treatment. So it gives us understanding that even in that era, we had some oncologists also. Now, like we have hallmarks of cancer, disease. So similarly, the same hallmarks were described in Sushruta, and some are mutational, some are non-mutational. And what Ayurveda says that whenever there is an extreme accumulation of all Vayu Pitta Kapha, the Agni is doused and produces lot of Ama, and then there is an uncontrolled growth of a Dhatu. Dhatu means tissue. So what Ayurveda says, Dhatu Viddhi Mahantamaha, means it is an uncontrolled growth. Then, so this is a one hallmark which can be compared with the modern science. Then we have another hallmark called angiogenesis. So what Ayurveda says, Anantamulam, means it goes very deep, it keeps on spreading. So this concept is similar to angiogenesis. Then it has got a replicative immortality according to modern science. Okay. So what Ayurveda says that Chira Vruddhi, when the word Chira Vruddhi is used, Chir means Chiranjeev. In Ayurveda, what we say, when you bless someone, Chiranjeev Bhava, it means you live immortal. So same word is used specially in Ayurveda, that there is a Chira Vruddhi of this Dhatu, which goes in a deeper tissue, spreads in a deeper tissue. So this is, another hallmark of cancer cells as compared to modern science, what is written. Then immune evasiveness is another hallmark, which is described by American Association of Cancer Guideline 2022. So what Ayurveda says, Apakam Mandarujam. So the immunity is not that aggressive. If immunity is very aggressive, then immunity will show signs, symptoms of acute inflammation. So there is no acute inflammation. There is a chronic, ongoing inflammation. So apakam mandarujam, and that's why the cancer cells do not die. So that is immune evasiveness. And then what Ayurveda Acharya says, adhi arbudam, viarbudam, kalantarai asadhya. Like what we say, it has got invasiveness, it has got invasiveness, it has got metastatic property, it spreads from one organ to other organ. either disease can appear at two sites, same disease, like a breast cancer patient can have breast cancer and also it can also be in the lung. So at one time cancer can appear at two different sites, or patient is suffering from breast cancer and later on develops metastasis in lungs or any other organ. So this is the terminology used in Ayurveda, adhi arbudam, dvi arbudam. And when it becomes metastatized, it becomes asadhya. So very clearly, all hallmarks of modern science, American Association of Cancer Guideline 2022 are absolutely fit into, absolutely fit into. Madam, slide number 121. Slide number 21. 21. Slide number 21. Yes, just below that, 22. 22. Sorry, yeah. So you can see in that. And then there is a phenotypic plasticity. So we have all phenotypic plasticity as it is written in Journal of Cancer Discovery, American Association of Cancer Guideline. So similarly, we have Vata, Pitta, Kapha, Rakta, Mansana, Medasa. So these are different phenotypes of the cancer. And finally, like what we have treatment, chemotherapy, surgery, radiation. So similarly, Ayurveda says first you do a debulking treatment, that is a karshana chikitsa. You reduce the size of tumor cell by whatever means you can do, Deepan, Pachan, etc. Then a surgery to be done by a skilled surgeon is the word used. A shastradnya, who is a shastra karma to be done, who is expert in doing oncosurgery. So that is the word used, the skilled surgeon, followed by Agni Karma in order to achieve the 100% necrosis so that cancer cells do not spread elsewhere. That area has to be burnt, which concept is again similar to, I feel, radiation. And afterward, you give treatment so that cancer doesn't, relapse or there is no metastasis. This is called Rasayana Chikitsa. This Rasayana Chikitsa is different than immunotherapy of modern science, so not to be confused. Our Rasayana is something different, which we will discuss in a due course. So this is a complete, the description of Arbuda and its hallmark which are comparable to your modern science, absolutely 2022 guideline and the treatment.
There was a lot of Sanskrit in there for the Americans and the non-Sanskrit speakers, but I think that you did give enough English
translation. Yes.
That people can.
Even one I took an advantage because you also said some Sanskrit words, so I used only one or two words. That's it, not more than that.
Dr. Ranjit, we've given some introduction. What would you like to say about Vedic understanding of cancer? You can unmute yourself.
Yes, sure. Hi everyone, good morning, good afternoon, good evening, and thank you Dr. Bhaswati and Dr. Manoj for this wonderful opportunity to share our thoughts with all of you. So as the question, let me share my screen. I hope it's visible.
Visible, thank you.
So these were the 6 questions we were supposed to deal with, and we will go into Ayurvedic understanding of cancer. Now is cancer mentioned in Ayurveda already? Dr. Nitin has spoken a lot about it. So we will skip that. The next, another important question before we go to the understanding of cancer is really Ayurveda necessary for cancer treatment? That's a big question. Billions and trillions of dollars are being spent all over the world for this treatment. And why this age-old 4,000, 5,000 years old science? What is going to do in this type of complicated disease? That's an obvious question everybody can have in his or her mind. And then we will go for what are the aims of Ayurvedic treatment, and that will also put some light on this issue. So why Ayurveda is necessary in cancer treatment? So again, there is an asterisk mark like conditions apply. These are all my own thoughts. They may be wrong. I am not God maybe. So they may change in due course of time. But as on today, I believe if you don't agree, please unmute yourself and you can ask now or later. Most welcome. So the basic understanding is will go line by line. Now cancer as we generally understand as a tumor. So there is exception of non-solid or liquid tumors like leukemia. But by and large, tumor is a hallmark of cancer, but this tumor is not a disease, to understand. So really, tumor is not the disease. Then what is the disease? So what I believe is, tumor is a symptom of that. Then what is the disease then? So that the tendency that the tumor comes again and again, that tendency should be considered as a disease importantly, because what happens if tumor is being removed, as Dr. Nitin rightly said, maybe by surgery or chemotherapy, radiation. So tumor is gone, disease gone. Does that happen? It can come again. It comes again and again. So that tendency that it will come again and again, even if you remove that, is the actual disease. This is what I believe. And now conventional sciences, all surgery, chemo, radiation, are more concerned with tumor and they are very well versed to deal with that tumor and they can reduce or get rid of the tumor very nicely. But Ayurveda is more concerned with the tendency. So once the tumor is gone, generally what happens, patient has to be oncologist. Now there is no evidence of disease in your body, the oncologist says. Now what to do? So keep on checking after 6 months, 1 year. And if it comes again, then again same all the treatment. This is a general scenario. But what should I do so that it doesn't come again? What should be done for that? I am not saying it is zero. Modern medicine or conventional medicine also has some pathways, but this is a more home ground for Ayurveda to deal with this tendency. And both the things are important. So dealing with the tumor is also important, and dealing with the tendency that it comes again and again. That is also equally important. So we can say that addition of Ayurveda is a must in cancer treatment. Whenever I say here addition, that itself explains that only Ayurveda, without modern medicine, should deal with cancer. Is again not my opinion. I need to be very clear about that. So both the sciences going hand in hand is very much important in this all scenario. So both of them have some potentials and some limitations. So both, if we can amalgamate them or have a good fusion of both the science, then we really give or offer very good life as a quality and a quantity also. So in other words, we can say we can add years to life and life to the years of the cancer survivors. And what are the aims of Ayurveda treatment? Again, okay, we have decided that okay, Ayurveda treatment we are going to give to our patient. So what are the aims? Means what exactly you want to do with that particular patient of cancer? So these are the aims on which guidelines I work in my team. First and the foremost aim obviously is to improve quality and quantity of life. Then prevent or minimize the side effects of conventional medicine. These are kept deliberately in red color because it's debatable issue. Most of the oncologists may not agree with this, but we will discuss it in a separate chapter if we time permits. Then management of various sequelae which are because of the disease or because of the treatment. Suppose there is a prostate cancer and the testes have been removed now, orchidectomy. So that orchidectomy also has many other effects on the body of that patient. But now testes have to be removed. But what to do, how to deal with those things, that again Ayurveda can take very good care. Then as we have already explained, prolong or prevent the recurrence of the disease. It will come back, that tendency, we can deal with that tendency. And to some extent, regression of tumor or the metastasis with Ayurveda treatment, this is also possible. But again, as this is an era of research and just because I am saying that things happen, it should not be the thing. All the results should be there. Means in our clinic we maintain all these things, all this data. It's a well documented manner that is equally important. And let's now come to the hallmarks of the cancer. How do you understand cancer in our clinic? Is a basic question, and there are two sub questions to this question given by IOWG. And what are the treatment principles on Ayurveda perspective? Dr. Nitin has already mentioned very nicely. I would like to have just few additions to that. So as Dr. Bhaswati initially told that means whatever modern information or the conventional sciences, whatever they are providing, we consider all that. So all the pathophysiology points given by the conventional science, we definitely think over them. And then we transcribe, or we try to transcribe all those things in our terminology. We are not translating it, but transcribing. There's a little difference, and I'll explain it afterwards. What are the treatment principles then? As previously Dr. Bhaskati or Dr. Nitin had told, in Ayurveda we have doshas or bioenergies and dishas. It's a little serious thing, but let us understand there are two factors. There should be like lock and key. There are two should be together. So doshas will have some effect on these dishas, and when they together will unite, then only any disease can happen. So there are three bioenergies, we are going to talk about that. And there are few doshas or the tissues that are similar to the body tissues. And if these bioenergies vitiate all these tissues, then only pathology of cancer can happen. That is the understanding. Now, what modern medicine tells us, or the conventional medicine, there is a dysplasia, then fast and irregular cell division in the body in cancer. Now, when we transcribe this information given by conventional medicine in our language, we understand it like a Vishama and Chalaguna. Dysplasia is Vishama, means irregular, and fast is Chala. So these properties of Vata are being vitiated. This is what we understand in our transcription. Then there is always necrosis, ulceration, and bleeding in the malignant tumor. What we understand in our language is Ushna, that is hot, and Tikshna means penetrating property. This Pikta is getting vitiated, because of which necrosis and ulceration and bleeding are occurring. And there is a SOL formation, space occupying lesion. So there is a growth or tumor or arbor. So this Snigdha and Pichila properties means this anthus type of thing, or the moisture which will keep the all powderous things together and build one big space occupying lesion. So this is the vitiation of Kapha. So all these gunas or properties are there in the normal doshas also. But if they excess or exceed their quality or quantity or their proportion, then we call it as a vitiation. If they are a normal, then the healthy status will continue. And if they become abnormal, then only they will get converted into the disease. So all the three doshas are getting involved. This is I wanted to add in this. And what are the treatment principles then? There are some Ayurvedic medicines which will nourish or nurture the healthy cells, as rightly mentioned by Dr. Bhaskati. We call it as a rasayana. Then there are some medicines which will take care of the digestive fire. We call it as a dipana. Digestive fire is any type of transformation in the body, whichever is occurring, metabolism by and large, it all comes under the digestive fire. And get rid of the toxins, again this Dr. Bhaskati has rightly mentioned. It is to be done slowly but continuously. We cannot remove all together because there is strength is less. So it has to be done slowly and continuously. In our language we call it as a pachana or srotashvara. Now these three principles are there. So if we have an overlapping circle, then the medicines which have all three properties together will be the best medicines for cancer. So the medicine which is Rasayana and Balla also, it is Pachana and Srotashvadhan also, and it is Agni and Dhatvagni also. All three properties, like in cricket, in India we are very much fond of cricket. So in cricket there are some players who are only batsmen, who are only bowlers, but there are few, they can bat also and bowl also. We call them as all-rounders. So this type of all-rounder medicine are the drugs of choice for cancer. The commonest example is Giloy or Guruchi or Amrita, Thymospora cordycelia. It has all the three properties together. So automatically from Ayurveda perspective, that will become a very good medicine for cancer. Again, there are many other things to be thought over directly. Every cancer, okay, start taking Giloy or Guruchi, that is not the case. But by and large, it can be a good drug of choice. Sorry. So this is it I would like to say, and I will stop my screen sharing. You can move ahead.
Yes, thank you, Doctor. And in fact, we'll move on to exactly that next question of how evidence is gathered. I do want to show you one slide before we go to that question, which is a study that we are part of. Jeffrey White is the director of the NCI, National Cancer Institute of the USA's, Office of Cancer and Complementary and Alternative Medicine. Both Dr. Manoj Reddy and I sit on that committee. It's about 25 scientists from around the country who are examining the literature that is published, the evidence that is published on alternative, integrative, complementary approaches and therapies for cancer. And so I'll show you the link. In fact, I'll put the link in the chat for the database that Manoj Reddy and I are part of creating. We did a study of us with a subgroup of us from that committee, and we asked the question about Ayurveda in the USA and professionals of Ayurveda, whether they are BAMS graduates who are in the USA or people like me who are allopathic doctors who are practicing some elements of this cancer theory that Dr. Nitin and Dr. Ranjit talked about in integration with what we do in the USA. So I'm not an oncologist, I'm a family practice doctor, but I do integrate. And then I actually have degrees in both, but those who are in one part using the other, that's what's called integrative. So we asked US Ayurveda professionals, what about your work with people with cancer? And this was because of an earlier study that I had done that asked this in conjunction with a whole bunch of questions about different diseases and different tools that are used. And as you can see here, more than half say that they work with cancer patients. So Jeff and I said, well, if there are Ayurvedic people that are having this conversation and using therapies for cancer care in the US and oncologists don't know about it, then there's a potential problem there, because while it might be helping, the oncologist, A, should learn about it, but B, they should also have open mind that that's what the patients are doing. And why are they doing it? What is it that modern medicine is not providing that Ayurveda is providing? So we pursued it, and if you guys do get this slide, or if you write to me, you can get this, because this is actually published, and it was presented by one of the co-authors, Julia, at a NAMA conference a year ago. But I wanted to show it so you understand that there is discussion about evidence for cancer. And so I'm going to actually, instead of me sharing about clinical publications, I'm going to stop sharing and have Dr. Ranjit, because your slide was already up. Can you talk about the evidence base for cancer? And the way that we're going to phrase it is the evidence according to like clinical evidence-based medicine and conventional medical care, how the evidence is gathered in Ayurveda, and what kind of evidence is there for those oncologists who are saying, well, Ayurveda doesn't matter unless there's evidence for it. So where is that evidence? And please feel free to share your slides again, your screen again, Dr. Ranjit, and then we'll go to Dr. Nitin, and then I'll see if my slides do not overlap with yours, and I'll show mine. Dr. Ranjit, please.
Yes, yes. So thank you very much. This is really wonderful question, and a lot of debate going on in Ayurveda faculty or fraternity, whether research is needed even for Ayurveda or not. So I belong to the thing that research is definitely needed, but there are some issues. So the best thing which is mentioned or which is understood nowadays is RC. Randomized clinical trial is the hallmark for proving the efficacy of some drug to the disease or modality and the disease. So this is the most ideal way to establish. But there are some difficulties, or it's a little bit impractical, because from Ayurveda point of view or Ayurveda thinking, it's theoretically a little bit difficult to curate one protocol for all the patients. Because again, we believe in individuality. Some is a Vata dominant, Pitta dominant, so there can be some changes in the treatment, or some season is different, or the area or the land where patient is living. All those things matter, and there can be some changes in the medicine. So only one protocol for one disease is a little bit difficult, but still we can overcome that problem to some extent. Another thing is ethical clearance, because if we want to have some RCT, then we need to give only Ayurvedic medicine to the cancer patient, which ethically may not happen, because the problem will come, the ethics committee will say the patient cannot be deprived from the conventional treatment. You cannot say to the patient that don't go for chemotherapy and take this Ayurvedic for medicine for this trial. So again, this is one practical problem. Now, only thing which remains is we can test the efficacy of Ayurvedic medicine in a remission phase. Because in a remission phase, there is anywhere no modern medicine or conventional medicine. Only Ayurvedic treatment can be given. But again, what will happen? There will be a huge requirement of money and time. Why? Because when the patient is in remission, so you need to give medicine for at least 5 years to the patient to show that the disease has not recurred. So at least 5 years of follow-up you need to do. Then 5 years you need to give all the Ayurvedic medicine, whatever you want to give to that patient, and all the investigations, say yearly or 6 monthly PET scan, blood, this, that. So monitorial cost and the cost as compared with time, both are very much high. There can be some dropouts. Again, we will need some control group for that on all the investigations for that also. So the huge requirement of money and time is actually not allowing us for this type of trial. Again, one more trial can be possible that during chemo and radiation we give Ayurvedic medicine and the side effects are reduced. But again, as I have already made it clear, it's a little bit debatable issue and we can talk about it. So this is the only area where RCTs can be done, but this is currently practically not very much feasible. So what can be done? Now if you go to Google Scholar, I just while surfing, I just went to Google Scholar. So there are about, when you put cancer and Ayurveda like this in the search, you get total publications around 1,13,000, and of which 93,600 are the case reports. So this is the thing which we can really do in our clinics. Whatever results we are getting, we can just publish it in the scientific world, and slowly the evidence can gather that okay, something different which conventional medicines are not able to do to some extent, that addition can be done with Ayurveda definitely. So this publication of case report is the way in today's era, and we also try to do that. So during assessment, again, the clinical assessment as per Ayurveda perspective or from modern clinical methods also, we are doing it and documenting it at our clinics. Then again, investigations, all type of investigation, pre and post, sorry, pre and post, and we document them all very nicely, and we can show the changes in the investigation. So this is how I feel that evidence generation or research type of thing can be done in Ayurveda. Suppose tomorrow really a very good sponsor comes in or chips in, and then really this type of multicentric trial can be done. Nothing like that. But by the time that happens, this is the middle way. This is what I believe. I would like to stop my screen sharing and over to you, Baswati.
Thank you. Dr. Nitin, would you like to talk about the evidence? Maybe show some stuff.
Yeah, so when I'm working in Tata Hospital, as you all know, I asked the same question to Dr. Badwe, who is a dean. So he said it was a very apt answer that the reductionist approach.
One second. The Tata Hospital is a very famous cancer hospital in Bombay. I just wanted to let everyone know that, who doesn't.
And Dr. Badwe is a dean, and he said in open auditorium that when the reductionist approach of modern science failed, we need to understand what are the other things which we can offer. Because based on even American cancer research, almost 1,500 people are dying because of the cancer every day, and the same number is National Institute of Cancer from India. So why this is happening? There must be something. So there has to be some holistic approach which we should understand. At the same time, he also requested, let modern doctor and Ayurveda doctor sit across the table, understand each other's principles, and I'm lucky, I'm blessed that I'm able to work on the same principle. So genetic mutation is the cause, like Dr. Baswati, your one of the question is what is the biomedical evidence that Ayurveda approaches work. Okay, so I am focusing on that question, biomedical evidences, your biomedical evidences. So genetic mutation, yes, it is the cause, it is one of the important causes, but something happens before that. And what is that? Is a cellular biofire derailment. There is a complete cellular biofire derailment, to that cellular biofire we call Agni. Modern science they call mitochondria. So I explained and I proved that mitochondria and Agni, what is written in Ayurveda, are same. I will not go into the detail of that. This mitochondrial dysfunction leads to DNA mutation. Thereafter, cancer progress starts. So, and that's why even after giving chemotherapy, radiation, surgery, as Dr. Nimbalkar said, that cancer keeps on, recurring. There is a relapse. So something is lacking. Let us treat that root cause. So the root cause is cellular biofire, Agni, what Ayurveda says, and mitochondria, what modern science says. So do I have any drug which will work on mitochondria and Agni? So there is a one simple but very important drug called ginger, which is available everywhere. So trial was done. Clinical. I will explain. This slide number is. You can go on. Slide number is 30, 31.
This one?
Below that.
This one?
Yeah. So mitochondria are the new class of drugs in the cancer. Okay. The drugs which works on mitochondria are called mitochondria. Okay, now this is again from the Journal of Molecular Sciences. It's a latest journal. Synthetic mitochondria are very dangerous. So you can say that there are a lot of side effects. So why not to look at the herbs which are natural mitochondria? Now, ma'am, will you please go to the next slide? So these are the natural mitochondria: ginger, berberine, ashwagandha, curcumin, andrographis. According to Ayurveda, to improve cellular biofire, that is Agni, we need bitter alkaloid. So andrographis is full of bitter alkaloids. Berberine is full of bitter alkaloid. Ginger, again what we call to improve the mitochondrial biogenesis. There is a constant damage to the mitochondria, and because of which your genetic mutation is happening frequently. And there is a one marker. Now Dr. Baswati, this is a biomedical evidence for you. 8-hydroxy-2-deoxyguanise. You can just go to the next slide. Yes. 8-hydroxy-2-deoxyguanise. It's a mitochondrial marker which is very easily accessible through your urine test, through the patient's urine test. In cancer, when the mitochondrial damage is more, this 8-hydroxy-2-deoxyguanise is excreted through urine. If you give ginger, this 8-hydroxy-2-guanise is reduced. So that proves that mitochondrial damage is reduced. Once the mitochondrial damage is reduced, cancer process has to stop or has to be arrested. So this is one drug, mitochondria, ginger, which we call is working on Agni. Another drug, what we call Chitraka, okay, Plumbago xylenicum. Will you please go to the next slide, please? Yeah, see again this is for the ginger. Next slide. So ginger, this is from the Onco-Target, Journal of Onco-Target, Plumbagin on your right hand side, Plumbagin, it restrains hepatocellular carcinoma. So again it is working on mitochondria. There is another drug, piperine, which arrests the cell cycle. Whenever there is a abnormal cell cycle and all kinases which are working in a rapid fire position, rapid fire condition. So piperine arrests all these kinases and arrest the cancer progress at G1 or G2 level. Now what we say that Chitraka, piperine, ginger, berberine, they all are Agni, Deepan and Pachan. No, my role is to bring Ayurveda doctor and allopathic doctor on one table. We have to understand our in one parlance. There has to be one language. So I think this could be the bridge. I am giving you biomedical evidences where the piperine works, where the plumbagin works. If the lady is having, triple negative breast cancer, and in that case, this plumbagin works better. The piperine works better. So these are the biomedical evidences. Now, when we say Vata, Pitta and Kapha, it's difficult to understand by modern science. But when I'm also working with some genetic scientists in India, okay, so Vata people, they are more prone to develop proliferation. Vata people are prone to develop injury fast. But God has given them a property, they can heal fast. But in cancer, what happens? This healing process is fastened and there is an excess proliferation. So if Dr. Baswati is able to identify person's personality with the help of Ayurveda and say that it is a Vata Prakruti and predicts that yes, this is a Vata Prakruti, he is prone to develop proliferation and metastasis fast, so let us give something which will reduce Vata. So you can do Basti Chikitsa, you can give Ashwagandha. Pitta Prakruti people, they are hypoxic at cellular level. They have got hyperactive EGLN gene, and because of which they are prone to develop inflammation and bleeding fast. Angiogenesis is very fast in Pitta Prakruti. So now when Dr. Manoj Reddy and Dr. Baswati know about Vat, Pitta and Kapha, and they say yes, this patient is Pitta, he has got angiogenesis, so you will find out a drug which will arrest angiogenesis. So Ashwagandha is the drug which will arrest angiogenesis. Berberis is the drug which will arrest angiogenesis. Now somebody is in the Kapha Prakruti, so we know that Kapha Prakruti, Kapha is a more of adhesion molecule. It is difficult to break, Kapha cells. So knowing this property, I will use either Bhallataka or Chitraka so that, this Kapha can be broken down, Ama can be broken down, and a person can be treated and prevented from the further relapses and metastasis. So these are the very beautiful, I feel biomedical evidences. These all trials are done in vivo and many trials are being conducted. Clinical trials are also being conducted. There are some drugs like curcumin, which works on mitochondria. So their special curcumin formulations are developed. They are called mitocurcumin. Okay. So they damage, they take out the damaged mitochondria from the body and make body to regenerate healthy mitochondria. Once the healthy mitochondria are generated, your cancer process is arrested. Then most important thing, we give Langhana. Now if you just scroll up and go to the slide number, I feel it is 28. Yes, outcome of fasting. Again, these are all experimental studies published in your all American journals. Just go down, ma'am. Next slide. Yeah, 36% reduction in metastasis just because of the fasting. In USA itself, they have conducted trials, short-term fasting and long-term fasting efficacy during the chemotherapy. And I don't think any oncologist will have any issue if I ask them to have only say gluten-free or dairy-free or bakery-free diet and keep them fasting for 7 to 8 to 12 hours before chemotherapy. It upregulates all kinds of apoptotic molecule. It reduces insulin-like growth factor signaling. It reduces interleukin 6. It reduces fasting, reduces tumor necrosis factor alpha. It increases mitochondrial biogenesis. It increases autophagy in the healthy cells. So what more biomedical evidences are needed? Now we need that something should take all this ahead and do various clinical trials. That's what I feel. So these are the biomedical evidences and the role of Ayurveda. The treatment today what we have is a chemotherapy, surgery, radiation. But what we need is a onco-preventive therapy. So Ayurveda plays very important role as an onco-prevention. So it will because 90% of the death in cancer is because of the metastasis. Just go on the slide number 4. Slide number 4. See, this is from the Journal of Bioenergetics, 2012. More than 90% of the death in cancer is because of the metastasis and not due to primary tumor. Will you please go to the next slide? And these are the paradoxical effects of chemotherapy on tumor relapse, because it is from the Journal of, again, Seminars in Cancer Biology, 2020. Chemotherapy has got, it's a sword, it does increase the chances of relapse. It causes muscular permeability. It improves, it causes tumor favoring inflammation. So yes, we cannot deny chemotherapy, but at least if we can infuse this kind of Ayurveda treatment based on principles of Ayurveda, I think we can save a lot of lives. Just go to the next slide. Now this is from the Lancet Oncology, that yes, oncotherapy is required, chemo prevention is required. The article was published twice. Okay, so identify high risk individual, you change their diet, lifestyle, that is also onco prevention. Now those who are pre-invasive patient, pre-neoplastic, you give them some corrective measures. Along with that, you give them some herbal preparation, some Ayurveda guidelines, some Ayurveda drugs you can give. And then third is successfully treated cancer patient. To them, you can add, more aggressive Ayurveda treatment. So I think, this will complete the circle if we consider Ayurveda as one of the important pillars in the treatment and call it as an onco-preventive treatment. That's what I feel. I have got a biopsy evidences that if you give Langan, if you can go to slide number 29. Dr. Baswati is a great inspiration for me. She made me to find out all these references so that you all are, I am able to give you all these things. Slide number 29.
Yes, one moment. Let's see if I can. This one.
Below that. Next, 30, sorry. So see, these are the biopsy evidences. If you give Langan fasting, your insulin resistance reduces, insulin sensitivity improves. Your uncoupling protein, which we Indians are not having, and because of which, there is no thermogenesis, and there is a lot of production of intracellular armor, which is nothing but high molecular weight glycoprotein, and that generates the insulin resistance. So if you give fasting, there is a biopsy evidence. Biopsy evidence is a gold standard evidence. No one can challenge that.
So there's a question about fasting for how long?
Yes, again, wonderful. So Vata Prakruti person should not do fasting more than 8 to 12 hours. Pitta Prakruti, again, not more than 6 to 8 hours. Kapha Prakruti, you can do whole day fasting. So this identification of Prakruti will play very important role. And there are genetic markers for Vata, Pitta and Kapha.
And if they're already losing a lot of weight, kacheksik, then you will obviously tailor the fasting to that person's ability, right? It's not the same for everyone. That's
so fasting, when I say fasting, means somebody is losing weight, otherwise also losing weight because cancer cells are eating whole nutrition. So give a diet, which will kill cancer cells and will nourish the patient. So at least avoid gluten, at least avoid animal protein, dairy, all those things. Give them a simple, clean diet. Don't overfeed them. Avoid sugars. If we are able to do that, is also fasting. So Laghu Ahar and Langan, these are the two words. Even giving a diet, low calorie diet, calorie restricted diet, that is also like a fasting. So just give a gruel, which has got all 20 amino acids. Yes, sorry.
When you say gruel, are you talking about kanji, which is rice boiled in 8 times water, or are you talking about moong dal, which is in many times water, so it's like a protein?
Yeah, rice and moong.
Both together?
Both together. This has got all 20 essential amino acids. You give that.
And do you give it as khichdi, or do you have it in high amount of water?
Khichdi.
Okay. Yeah. So for those of you who know what khichdi is, there's a lot of questions in the chat about that. So please finish. I just wanted to put those questions in there because they were
these are the biomedical evidences and exact role as an oncotherapy. Then is Ayurveda really necessary? Yes, it is necessary. Then whether, am I allowed? So will you please scroll up?
This one?
No, just a minute. Now, just a minute. Slide number 24, I think.
Oh, up. Okay.
Up.
This one?
20. Just below that. Below that.
Great slide. For those of you who are taking screenshots, this is a very good slide. And this
person, he has given the Nobel Prize. He has done work on fasting, and he has said that if you do fasting, it can prevent cancer and all. Okay, just go below that. Go up. Yeah, this. He is my guru, Dr. Devchand Gala. He taught me fasting in 1990. He should have received, he's an MBBS person from Nair Hospital, and he has treated many patients, not only cancer but also the rheumatoid arthritis. So anyway, just scroll up, ma'am.
Up or down?
Yeah, I just scroll up.
This way?
Wait, I will share.
I don't know if up means bigger number of slides or up means lesser number of slides.
Just a minute, ma'am. The slide number 6. Below that. 7 number, yeah. Now see, this is a WHO strategy. Your WHO former director, Dr. Margaret Chan, she said, traditional medicines of proven quality, safety and efficacy, they contribute to have the goal of ensuring everyone should have good health. So if it is proven, Why not? And ma'am, let me tell you, 35,000 herbs were screened, of which 3,000 herbs they were found to have reproducible anti-cancer properties. Reproducible, the word I am using. So why not to use, this, and most important and most potent anti-cancer allopathic drugs, paclitaxel, camphotericin, podophyllatoxin, vinca alkaloids, they all are from herbs. Thanks to US scientists, they developed it between 1960 to 2002. So it's a time, one should look into the Kalamegha, Tinospora, Curcuma, Ashwagandha, cannabis, the Bhallataka. Why not to use this?
Great. So we have been talking almost an hour. I am going to have a couple of slides, and then let's focus on the question of how do we integrate for personalized care, what we do actually clinically. So I'll share my screen, and I wanted to make sure, we had a few kind of PubMed kind of slides, because there are people here who are oncologists who really want to see the quote-unquote mainstream evidence. So if you go into PubMed, which all of you know is a endeavor by the National Library of Medicine at the NIH, and you put in, to start, Ayurveda, which is the Sanskrit term, Ayurveda is the Hindi term. If you put an Ayurveda with an A at the end, and cancer, what you'll see is only 12 results for clinical trials. And I'll show you one of those, which I thought was actually quite good. But then if you put in Ayurveda cancer without the clinical trials, and all of them, there's 957 results. So when I worked at the NIH, I remember they taught us about expanding our strategy, because sometimes the word is Ayurvedic, right? IC at the end. So it's not going to pick up Ayurveda. So if you just put Ayurveda with an asterisk, which means anything at the end of it, you'll get 1,088, which is like, 130 more. So there's 1,088 articles. But then I started to screen through them, and I found that actually some of them are not really that high quality, and some of them are preclinical studies and a variety. So I just have a couple of, 3 more slides I'm going to show you about articles that I've found. One is, I think, a formulation that most of you have not heard of, and I don't think that Dr. Nitin or Dr. Ranjit mentioned, and that is Yashti Madhu. Its North Indian name is Muleti. Yashti Madhu is the Sanskrit word, and the English word is licorice. But it's not the licorice that is purified and all. It's licorice bark. And when that is put into the formulation, this is Glycyrrhiza glabra, which is the botanical name, it actually is very good as a demulcent, and it's very good against the side effects of radiation. And so there was a study done now 14 years ago, or probably 15 years ago, and this is the best table from that particular publication, which was in IU, which is considered to be a very good journal in the Ayurvedic world, and it's also a PubMed journal. And so you can see that it was studied for its use on a few different symptoms of radiation. One is mucositis, one is xerostomia, which is where the salivary glands get kind of destroyed, and one is the larynx getting scarred, which is, the change in voice. And so you can read through this study. There's the DOI. You could take a screenshot of this. And then there are a few other studies that I really liked. One was a randomized controlled trial, which was the effect of combinations of Ayurvedic drugs in alleviating the drug toxicity and quality of life for patients with chemotherapy. Dr. Nitin talked about this issue, and so did Dr. Ranjit, because we know that when people get chemotherapy, they can have toxicities, because the entire purpose of the chemotherapy is to give enough that the healthy cells don't die, although they know some will, and that the fast-growing cells, which are the cancer cells, will die. And so all the healthy, fast-growing cells die, but the others shouldn't, and you take them to the limit until they can stand it. If you're interested in this, understanding it more, Siddharth Mukherjee's book called The Emperor of Maladies talks about this in sophisticated but more layman ways. There was another study that was about Rasayana, which both Dr. Nitin and Dr. Ranjit talked about, and that is the idea of rejuvenation therapy and how to manage side effects, but also how to prepare the body using Rasayana. And then there was a study by a colleague of mine which focused on a very scientific approach to an Ayurvedic gargle, which is a liquid for radiation-induced oral mucositis. And I found that these were actually nicely done, scientifically done studies, but we don't hear about them. The last I want to show is 3 books that are on cancer. This is here because there is a center in Maharashtra outside of Pune known as Wagholi. And the entire family has surrendered their lives for several generations to treating cancer. This is part of their devotion, and they take thousands of doctors and train them to integrate Ayurveda with modern medicine. They take modern doctors and Ayurveda doctors and others, homeopathic doctors. They have a pharmacy where they hand make medicines, including the bhasma medicines, which we'll talk about in a moment, and they collect data. And so Dr. Vinita Deshmukh and the entire Sar Deshmukh family has been working for decades on using Ayurveda for cancer, and it's certainly, you can look up their names and see. Actually, I think this study was by Vinit. Yes, there's Vinita Deshmukh's name right here. So this is the whole Sar Deshmukh family, and it's a huge body of work. We also have books by, this man was at BHU, Dr. Gyanendra Pandey, and this is by Jailan Shastri, The Introduction to Cancer. Jailan Shastri is a great, he's well known for his work in the herbals of Ayurveda. So the herbal formulations and herbal medicines, of which Dr. Kochar has mentioned several. Dr. Kochar has many slides on Vijaya, which is in America known as cannabis, and he talked about Dr. Syed, who is a very well-known specialist on cannabis and cancer. He's a biomedical doctor. But I'm going to turn off my slides and ask these 2 wonderful oncologists if you can talk just for a couple of minutes before we take some questions on what are some of the things you want to tell people about how you individualize treatment for cancers using the guidelines, but then how do you specifically do it? Let's start with Dr. Nitin this time. Dr. Nitin, how do you individualize?
Yeah, so first of all, early diagnosis, yes, it's an boon if somebody is diagnosed early and treated. Whatever treatment is given by your doctor, you have to follow, and follow the dietary guideline under the supervision of Ayurveda doctor, okay, very well. And there are certain herbs which are known as an anti-cancerous, they are proven to have anti-cancerous role. So you start that. What I do in my practice here, and I'm allowed to do, I am very honored, that on the day of chemotherapy, especially injectable chemotherapy, we avoid giving any kind of Ayurvedic drugs because we really don't know the interaction. Some drugs, curcumin, ashwagandha, I know they do not interact, but there are newer classes of chemotherapeutic drugs are there, so I don't know their interaction. So at least I avoid giving my drugs for 2 to 3 days, and again I start with my herbal formulation based on the prakruti of the patient. Okay, Vat, Pitta and Kapha. By and large, some Tridoshagna drugs, the drug which is going to take care of all Vat, Pitta, Kapha, we give that. And we keep the follow-up, very tight follow-up, proper investigations, all kidney function, liver function. We see that there is no, even if I use Bhasma, I don't use Bhasma that much. But even if I have to use Bhasma, I keep a very strict watch on the paper. If you can show slide number 82 or 83. 82 or 83 slide number.
Give me one moment.
Yeah.
Let's see. I don't know why I can't show this. 1 second. Oh, here it is, right in front of me.
No, not this. Not 82, 83. 82.
Yeah, I'm just scrolling down 1 second. 82.
Yes.
Yes, this one?
83, 84. 83 and 84. Now, So see, this is the metallic complexes are of growing interest in the field of cancer therapy. This is from Cancer and Metastatic Review, 18th October 2017. So if metal complexes like, cisplatinum is used since 1978, okay, it's very toxic. So there is a need to find out a safer metallic complex. So why not to use gold complex, copper complex, zinc complex? And why not harness the potential of this? Can you go to the next slide? So this is a tryptophan stabilized gold nanoparticle that target the tubulin, the microtubulin inside the cell, which form the cancer, which is the backbone of the cell, every cell membrane. So they exactly damage the cancer specific tubulin, the tryptophan stabilized gold nanoparticle. So, and when I did this study in my university where I'm working, so we compared the tryptophan stabilized gold nanoparticle. Of course, it was in a petri dish on a breast cancer, and we used gold bhasma, Swarna bhasma and Swarna Vasantamalti, which was found much better and cheaper to use. So this is again a experimental evidence. Just scroll to the next slide. Of course, sorry, this is all diet and everything. So this is what I have to say. You can continue your all allopathic medicines. Along with that, you take these herbal medicines, which are of the proven safety, proven efficacy and safety.
Okay.
These are all my cases, which I will not discuss, as you said, not to discuss the personal cases. Yeah.
We meant your person, but anyway, yes. Let's save those for question and answer. I hope we'll still have time. Dr. Nitin, sorry, thank you, Dr. Nitin. Dr. Ranjit, do you want to say anything about individualizing care and the approach you take? You're on mute, Dr. Ranjit.
Yes, definitely. So, can we have some cases for that and discuss, or only without cases?
We still have 2 or 3 minutes if you want to discuss some specific, how you individualize them. Yeah.
Actually, there are ample, but here there are some sample cases. I will just have. There are 5, 6, but we'll discuss 1 or 2 only.
Okay. Can you share? Yeah, good.
So as previously I had said that we use all the terminologies for modern oncology and we keep documentation accordingly only. We have our own diagnosis or understanding of the patient, but while presenting, everything will be in the conventional languages. So this is a case of resistant squamous cell carcinoma, grade 2 stage 3. It was in the right auditory meatus. And this is the photograph when patient came, the pinna was removed, the meatus was operated. But in spite of that, the cancer was progressive. So patient came in July 2017, the 68-year-old male. And this was a diagnosis done on 28th March 2017. In April, he was operated. And even after operation, the repeat CT scan showed again a big tumor, and which was again going to mastoid cavity, mandible and middle ear. Then he was given like chemotherapy and radiation. And even after that, the tumor was progressing, and this time it has gone to the CP angle, which is a cerebellopontine angle. So from right meatus, it went to mastoid and again to the cerebellopontine angle in the posterior third of the skull. And here this patient was referred for Āyurveda treatment by the oncologist. So after 3 months of Āyurveda treatment, this follow-up scan was done on September 2017. And it was a complete regression of the tumor, and there was no obvious mass. Karnofsky score for the quality of life was 8 on 10. So these were the regression, what was seen, means aims of Āyurveda treatment, which we had already discussed. So in this personalized patient, what were our aims and what we achieved is regression of the resistant tumor that was achieved, then improvement in quality of life was there, and control on long-term side effects of the conventional treatments like chemotherapy and radiation, what patient had taken, those all were reduced. So for my understanding, personalized means this. What do you want to do with this particular patient? Okay, I am treating cancer, but are you going to reduce the tumor, or are you going to improve his quality of life, or you are giving just symptomatic relief? What you want to do in this particular patient is personalization as per my understanding. And this is another patient, again infiltrating duct IDC, right breast, upper outer quadrant, grade 3 stage 2.
How long did the patient survive after the treatment?
Actually, after he was not from my city, he was from some another city. He was under follow-up up to 6 months. But yes, unfortunately, afterwards what happened, that we really don't know. There is a possibility there can be a recurrence again and something might have happened. But at least this regression was there. And what your question is, I have answer for this particular patient. She was a grade 3 stage 2 ERPR negative and HER2 positive patient, and she came in March 13, 2013, in my clinic with a lump. So I advised her to go for modern medicine or the conventional medicine, but then mammography was done in April. She came in March, and in April mammography was done, and she was diagnosed accordingly. There was a lung nodule also, but unfortunately that was not biopsied, so it was not labeled as stage 4. Then chemotherapy was given. Trastuzumab was denied by the patient because in those days, in 2013, one injection here was like 100,000 rupees, and that was not tolerable financially to the patient. So trastuzumab was not taken, even if this HER2 was positive and ERPR was anyway negative, so no question of hormone blockers. So immediately after she was given CAF protocol. Immediately after first chemo, she had a lot of side effects. Then she again came for Ayurveda, and next 5 chemotherapy, Ayurveda and chemotherapy were going hand in hand. So she completed totally all the chemo cycles, and for last 12 years, even after finishing all the conventional treatment, she is doing still she is good. Last follow-up with her oncologist was in September 2024. So patient is still in contact. So what we achieved in this particular case was good chemo tolerance in further cycles with good efficacy of chemo. That is the means point of debate. Many times what happens if the side effects are not seen, the oncologist will believe that the medicine is not working. But as rightly said by Dr. Baswati previously, so we protect the healthy tissue or healthy cells. So the chemotherapy, we call it as a cytotoxic therapy actually. So the good cells are saved from killing. This is only a hypothesis. I have few cases, but definitely not that big data. And the chemotherapy will kill only malignant cells. So on one hand, side effects are reduced, and on the other hand, efficacy is also improved. So both the things can be achieved. This is what we believe. Improvement on quality of life is like for now 12, 13 years, and prevent there is no recurrence till date. Last follow-up is in September 24. She visits every September to her oncologist. Now this
Sir,
case is
as,
published.
as an oncologist, I would like to say that the combination of ashwagandha and shilajit has worked wonderfully in preventing all chemotherapy and radiotherapy side effects for my patients from the last 7 to 8 years, 10 years which I've been practicing. Can you just elaborate on, is there any specific thing about ashwagandha and shilajit, or is there something else? This is a wonderful combination, and all my patients they've had a 70 to 80% reduction on chemotherapy and radiotherapy side effects.
Okay, okay, that's great, really great. But now what happens again? This drug, there are common toxicity criteria CTC. So accordingly, which symptoms are visible to the patient? Means in my practice, now this patient had a lot of skin rash and that type of thing. Some patient will have a lot of constipation or loose motions or stomatitis. So there are different groups of systems. Those are being targeted by the chemotherapy, and the symptoms are visible for that particular system. So in my practice, we plan the medicine accordingly. So
why don't we take that question on Shilajit and Ashwagandha in a moment? Why don't we go ahead and finish this case, and then we'll open it. I'll do a couple of slides, and then we'll open it up for questions, especially this one from Dr. Raghuraman. Please, Dr. Raghuraman. Yes.
Yeah, then there are few similar such cases. Now here in this particular case, we didn't do anything for the cancer. The patient was in August 2016, 41 years. He was a chronic tobacco chewer and classical textbook case, nothing any special. But this was his problem, severe trismus. He was not able to open his mouth at all, and he used to drink only liquids using a straw. So the patient came for Ayurveda treatment, and we gave our treatment. After 12 months, his mouth opening improved from 5 mm to 3 centimeter. So sufficiently good mouth opening was there, and the biggest thing he could do is he could wash his mouth from inside, which was not possible for 2-3 years. That was a big bliss for the patient, we can say. And as the mouth opening improved, automatically intake improved, and the weight gain was there 6 kg in 12 months. nothing, medicine was not given for any weight gain or tonic sort of thing. Scan was normal, but again, Ayurveda has not done much because anyway that was not big cancer actually, no new metastasis. But in this case, what we achieved was correction of the sequence. The trismus, which was very much concern for that patient, was improved, and automatically quality of life as the food intake improved, automatically weight gain was also improved. So quality of life and correction, those ends, 5 ends we had. Here the correction of the sequel was our achievement. And this is the pre-treatment photo. You can see this is a full strength mouth opening of that patient before treatment, and afterwards mouth opening improved to this extent. This is also not very big, but as compared to previous, after the commando surgery, radiation, fibrosis, everything, his mouth opening was sufficiently good and automatically weight gain was there. So there are many other few. This is a lung adenocarcinoma case. This case has also been published in the journal. I will not take much time in describing.
Your bibliography, I think Dr. Manoj was going to share your bibliography of all the case reports. So yeah, that's great.
Yeah, there are few more, but let us not discuss them as a scarcity of time. I will hand over the mic to you, Dr. Paswati.
Oh, great. Okay. So I'm going to share a couple of slides, and I just want to emphasize that Dr. Ranjit has mentioned that there are all of these case reports because that's the best way to show individualized care right now, because we can't do randomized, double-blind, placebo-controlled, which is considered A1 evidence. It just doesn't work for individualized patients. You can't give them things that they can't take. So for example, we talked about herbs. So ashwagandha should not be given if you don't have enough digestive fire. People coming out of chemotherapy oftentimes can't eat anything, much less have digestive fire for ashwagandha. So I think Dr. Ranjit and Dr. Nitin would agree with me that you have to have good digestive fire to give shilajit and ashwagandha. And without it, you can actually toxify the body because it's something they can't digest. So all of these herbs are here. I'm just going to tell you a little bit about my individualized approach. Let me see what I put in these slides. So I use the Dashaveda Pariksha, which I think all Ayurvedic doctors use on some level. There's a shloka. Here it is in Sanskrit, transcripted into English. Dushyam desham balam kalam anala prakriti vaya sattva satmya ahara. So the ahara is the food, and everything we give that's individualized follows basically this shloka. So actually I'm going to unpack this shloka at the NAMA conference this year, if any of you are going to Dallas. And I also want to mention about Dallas that Julia Arnold is actually presenting, I think at the end of this month, not at NAMA, at the end of this month, the update to the slide that everyone's been asking for, which is this one. So there are some updates from the study. Julia Arnold is one of the co-authors, and she will talk about that. Let's see if we can actually, Julia, maybe you can cue that up, and I'll just finish my slides, and then maybe we'll have you talk for a moment. So once we do the Dashaveda Pariksha, we have to work on the ahara, which is food. These are the chapters on food, and all of these foods are the excellent medicinal foods. And Dr. Nitin talked at length about giving rice with moong dal. So this is number 1 and 2. These are considered to be the agriya, or the best, the most wholesome foods. So you give them in small amounts. You give it as soup if they can't handle the khichdi because their mouth can't handle it. So anything from a soupy consistency to a dry khichdi, which is a rice and bean combination. I just took this slide. I just gave a talk on Rakta Pitta and Rakta, which is the blood, and how to fortify the blood. So first you want to fortify the predecessor of the blood, which is the fluid that comes out of the you'll say the gastric system and gets absorbed across the gut and into the blood. That's called rasa dhatu. And then you build up the blood, which gives these fortification, we'll say life-giving or jivanam properties to the tissues. So it's important that we give that. And it's not just what we eat, it's how and when and where, and we personalize that for cancer patients because they can't eat like the normal, healthy, basic diet. So we tailor it for them. And I don't see most of the oncologists tailoring the food. They usually just turf it to a dietitian. But giving people this kala bhojanam and then showing them which foods to eat and giving them recipes tailored to their particular situation in whatever part of the journey of cancer they're in is really important. I also wanted to mention that in these herbs, this was a key for me to mention, there's a conference that just happened this week called the International Conference on the Science of Botanicals, and they talked about the evidence for the 3 drugs that were mentioned by someone in the chat. Curcumin, which is turmeric, right? Curcumin is one of the chemicals that's like 1 or 2% of turmeric. Ginger, which Dr. Nitin talked about at length, and berberine. And these are, there's a lot of evidence coming up for cell culture, rat and mouse studies, as well as human studies, showing that these are very, very good. But you have to know what form to take. So there were questions in the chat about which one, how much, which formulation, which brand, and those are all what we individualize. I can't say to you this brand, but I will say that probably Dr. Nitin, Dr. Ranjit, and I will use turmeric and not curcumin, because the data show that turmeric as a whole has better properties than isolating out the turmeric, which has been associated with some hepatotoxicity, which is of course something that is at risk for people who are already going through the journey of cancer. So I wanted to see if Dr. Julia Arnold is here and she wants to give a 1-minute update, or if she's not able to unmute, then we'll just keep moving.
I'm here. I'm trying desperately to get my poster up here in a second. So if I can I share?
I think so. I think Dr. Manoj has to enable you, but you should be able to share.
There.
Julia Arnold, if you could.
Sure. Someone else is sharing. Replace current share.
Yeah, go ahead and replace me. I just put the slide up because people were asking for the contact information. So I put that into
here. So this is we had an update of this slide. Let's see, can you see that?
Yeah, it started sharing. Oh, there you go. It's up now.
There it is.
Yep.
Okay.
Slide view so we can see the piece.
Yep, there it is. Let's see, maybe do it this way. Sorry that this, I just was scrambling it to get there.
Oh.
Anyway, can you see just the...
maybe you can just put slideshow with the top center of your screen. See where it says slideshow?
Yeah. Do you see that on the whole screen?
Well, kind of, but if you go to slideshow, then you would see it. Go back again.
It is on slideshow. It's just showing this separate one. How about that?
Okay, that's perfect.
Yeah, okay, so this is just an update. We had been able to look at tons of data. The Ayurvedic practitioners were asked, what do you do with people with cancer? And it's just sort of like, for instance, what do your clients say is the reason why they come to Ayurveda? And what some of the goals and recommendations for clients with cancer. And a lot of them end up being quality of life, diet, digestion, and here what modalities would you recommend for clients with cancer, and it's routine food, counseling, pranayama, that kind of thing. How important are Ayurvedic modalities for different stages, such as recovery of cancer, mostly is important, but then other questions about cancer treatment, that was less important. They realized that that's, you use the allopathic means for cancer treatment. Some of the herbal therapeutics are here, and then a little bit more would be Ayurveda can play a role in a lot of these symptoms and, you know, emotional state, insomnia, quality of life, etc. And then the last ones are about how do you communicate with other healthcare professionals, and what are some factors for collaborating allopathic physicians and Ayurvedic professionals, and recommendations for research. So we're really interested in connecting allopathic researchers with Ayurvedic practitioners, and, you know, developing this evidence base by bringing the Ayurveda component to the allopathic.
Thank you so much, Julia.
Yeah, so thank you. That was probably what you wanted.
Yeah, so I appreciate you sharing that, because it is something that is focused on Ayurveda, coming from a place like the NIH, and allowing people to see that this is something that many patients are using. There is a comment in the chat about the fact, and this is from Christine, Coniaris, that says, can we talk about the allopathic oncologist who has issues with these treatment? Because many patients will say, look, if you're into it, I'll tell you about it. If you're not into it, then I'm just going to do it on my own, because I only see you once in a blue moon, and once the oncology acute phase of treatment is done, you abandon me until I get cancer again. So I want someone that can take me through this continuum of the journey. And so how do we make that conversation happen? That's one of the things that you addressed. And I know we have a few questions. I've been trying to answer them in the chat. I want to just give a last word to Dr. Nitin and Dr. Ranjit, and then hand it over to Dr. Manoj. Dr. Nitin, do you have anything else you wanted to add?
Even I have cases from the slide number 73 to 80. There are a number of cases which they are still surviving. So these are various cases I have treated with Ayurveda. I didn't get your question. What is the question?
Do you have any last words? Because we just need to finish in a couple of minutes.
Definition?
Any last words?
Integrated treatment is the best. When the reductionist treatment fails, you look at the holistic treatment, combine them both, and take it. That's it.
Thank you so much, Dr. Nitin. Thank you. And your experience and your time devoted to treating patients is wonderful. I wish we could have a separate talk on Bhasma, because as you mentioned, I will tell everyone here openly, as an MD with a PhD in Ayurveda, I use gold, silver, copper, iron, abrak, and the marine calciums. I don't use the ones which are forbidden in the US, which are mercury, arsenic, cadmium, and lead, because they are illegal. But in India, I use them because they're completely legal. And in India, as far as I know, they're also human patients. So the fact that India allows these medicines because they understand they're not toxic in a bad way, but they're toxic in a good way, means that bhasmas are the way that we, for the most part, treat many, many cancers. And I think Dr. Ranjit also uses bhasmas, although he can't talk about it. Dr. Ranjit, do you want to spend a minute talking about how you see US patients and this new forum that you're part of? And any last words from you, Dr. Ranjit?
Yeah, so last word means in Ayurveda there is a Andhapangu Nyaya, means one person cannot see and one person cannot walk, and they want to go to a destination. So what they should do, the person who cannot walk will sit on the back of the person who cannot see, and that person will show the road and the blind person will walk, and they both together will reach the destination. Alone, both of them are not able to reach their destination. The same thing will happen here. The conventional treatment, they have their some strongholds like reduction of the tumor or dealing with the tumor, and Ayurveda, they have their some strongholds, and they are weak also in some way or the other. So the fusion or the integrative treatment is very much important, and what Ayurveda is very much good in doing is bridging the gap. Whenever the disease is so much complicated, I will not blame or curse the conventional treatment. That is also very much important for the disease control. But the complexity of disease is such that any one treatment modality may not be sufficient to deal with the disease. So both the treatments will leave some gaps, and those are to be bridged by the another one, so that it's good for mankind. It is not the point that your science is great or my science is great. Our point is humanity is great, and let's join hand and do something for the humanity. Now about this online platform which we are about to launch, means already it has been started in some extent. So especially for cancer patients, traveling in my personal practice also, traveling to my clinic and showing all the clinical examination may not be possible every time because of the weakness, and sometimes patient is under chemotherapy. We advise him to avoid all the exposures just to reduce the chance of infection. So the technology helps a lot. So this type of webinars which we are doing, the same way we do in our clinics with the patients or on the online platform, get all the information and send medicine to the patient by courier, or some of the relative comes and takes the medicine. So this type of practices is a need of the world, and COVID has done a lot of bad things for our earth. But this new online platform, making it very much famous, is again done, has happened after the COVID times. So we try to use that platform and reach to the more number of patients and try to give relief to such type of patients. So this is all the aim behind this new venture that we are going to start.
And so you are the head oncologist for that venture that is going to provide cancer patients online consultation one-to-one and then giving supplements that they need. We're calling them dietary supplements in the US. You're going to send them to the patients and you're going to give them yoga therapy. You're going to give them the diet one-to-one counseling and a few other modalities, right? Lifestyle, breath work, meditation, and I think there's 25 doctors and clinicians working with you on that platform, right? So Manoj Reddy, we asked him permission whether we could talk about it before we mention it because it's not in academia, it's a private venture, and we look forward to you doing that, and people can write to you personally and know more about that when you launch, right? I'm looking forward to seeing what happens with that also. So we are at the end. I did my plug on Bhasma, and I talked about, let's see, I think there was a question about Shilajit Ashwagandha. We did that, and we also answered many of the questions in the chat itself. For all of you, the contact information for Dr. Nitin, Dr. Ranjit, and myself is in the chat, and Dr. Manoj Reddy has also posted about the next seminar for those who are part of the IOWG. We thank everyone for being there, and I'm ready to hand it over to Dr. Manoj Reddy. 7 minutes late, sorry about that. Dr. Manoj.
No worries. Thank you so much for your time. I know it's getting late in India, so I appreciate Dr. Ranjit, Dr. Nitin for spending their time with us at this late hour. Again, I want to thank you all for your wisdom and spending so much time with our audience. I'm sure there's a lot of questions. And it would probably take another hour or two to answer them. So I would ask that you use the contact information provided by Dr. Baswati to contact her at her email address listed in the contact section. If you could just copy and paste that information. Also, it was sent through the email, so you should have it. And also for Dr. Nimbalkar and Dr. Kochar for their emails.
Again, I just posted right after you did. Do you have any questions, Manoj, as we are copy-pasting this again?
I do not have any questions based on our talk, but let's... there's one question from Eric Acevedo. If you want to unmute your mic and ask.
Yeah, thank you so much. I raised the question about the curcumin, because I saw some articles about curcumin sensitizing actually doxorubicin, cisplatin, and paclitaxel, I think. So do you guys give it on the day of chemo? I know Dr. What's his name? I forgot. Mentioned that he usually wait for 3 days, but it seems like curcumin is a pretty good sensitizing for chemo if you give it together. Any comments?
Just to stop you for a second there, I don't know how much time the speakers have to answer these questions. So out of respect for their time, let me just ask them if they have any more time to answer questions. Dr. Ranjit, Dr. Nitin, Dr. Baswati, do you all have time to continue this discussion?
To be on a safer side, we don't give curcumin on the day of injectable chemotherapy. That's it. From next day onward, we continue. Because curcumin formulation, which I use, is in a very high dose, and it itself may cause nausea and vomiting kind of thing. So I try to avoid. It is not a normal turmeric. It's a turmeric with a standardized curcumin in it. So it's a different formulation. Absorption is very good. So that's why I avoid. But patient can have normal turmeric either with the high fat milk.
Yeah, Dr. Ranjit, do you have any comments on that?
Nothing special, I think I have done, and let us stick to the time, and nothing special from my side.
Okay, so I just came back from the Science of Botanicals conference, and they did say that there are some curcumin preparations that are creating hepatotoxicity because that's based on the way that the curcumin is taken out. Remember, curcumin is one drug in the whole turmeric. So generally, classic Ayurveda will use turmeric, but of course, classic Ayurveda didn't have chemotherapy. So that's why we don't mix them on the same day, as Dr. Nitin said. But we make sure that they have guduchi, curcumin, and the other things that they can digest appropriately on a regular basis around, so before and after the chemotherapy.
And before we continue, I'm not going to continue these hands that are raised unless the speakers are okay with continuing the discussion, and if you could set a limit as to how much you'd want to stay, I'd appreciate that.
Dr. Ranjit, Dr. Nitin, do you have time for maybe 5 or 10 more minutes of questions? Yes, Nitin says thumbs up.
Okay.
Okay.
We can take.
So he's up against a wall, so he says thumbs up, okay.
Okay,
Why don't you guide the QA?
sure. Lena, would go ahead and unmute your mic and ask your question.
Hi, thank you so much. I'm a big fan of Ayurveda. With all of the environmental pollution affecting butter, ghee, and plants, how is Ayurveda pivoting to address that? Because it wasn't present 5,000 years ago, all the new chemicals.
Dr. Ranjit, you want to take that first?
What is the question?
But I couldn't get it clearly.
Saying that with all the environmental pollution that's available, that's in our environment today, how are we adjusting our therapies, our ghee, and our various medicines that we give because of these environmental toxins, and how they would especially affect cancer patients?
This is a very valid and very practical question actually. And all of us are facing this on pollution. I personally believe if we complain that all the soil or all the land is full of dust, so you cannot cover all the earth, but you cover your feet instead. So you wear a shoe and you are not now troubled with the dust or that type of thing. So just instead of blaming all this, air is polluted, water polluted, food polluted, that is okay, we try to reduce that. But many things are out of our scope. So we have to accept many things as they are. So what we can do is we are supposed to increase our internal strength. And for that, the best thing which is mentioned by Ayurveda is Vyayam. If you are doing this exercise regularly, then what will happen? A lot of toxins and unwanted things which are getting created in your body day to day because of the metabolism or entering from outside, many toxins. So they are drained out very nicely. Generally, I give an example like you are having a vacuum cleaning of your house every day or once in a week. So if you don't do it for say 2-3 months, then what will happen? A lot of dust will be there in your houses. So that type of internal cleaning of your house is similar with the internal cleaning of your body, and which is exercise. Externally we clean by all bathing and all those things, sauna, many things. The sweating coming from the heat like sauna or the steam bath is different, but coming after the exercise is different. So you have a good habit of exercising for say half an hour, 45 minutes per day. You drastically reduce all the risk, not only for cancer but for most of the metabolic disease. So moving your body or exercising or using up your body daily is very much important, and so increasing the movement of the body and reducing the movement of this brain, both the things are especially necessary. So some meditation and some exercise together, I think, is a big master key for prevention from most of the diseases, so reducing the risk from most of the metabolic diseases including cancer.
I would like to add that I don't use milk and milk products in my practice, because today what milk we are getting is not as per the Ayurveda standard. Ayurveda clearly says you should not milk the cow unless her calf is 1 year old, and it has to be given once the cow is whole days, she is grazing under the sunlight and having fresh air and all. So we don't get that kind of milk. We are all getting pasteurized milk from thousands of miles away from us. So I don't use milk and ghee. I am very honest, very upfront. I am having a different opinion from rest of the Ayurveda doctors, but I don't use milk and ghee because we don't get that. And all cows, they are pumped with the growth hormones. Okay. Now the genetically modified cows are developed so that we can milk them out in their third trimester of the pregnancy, which is very cruelty, cruel free, so cruelful. So I don't use milk and milk products in my practice, and I agree. And about herbs also, I try to use as far as possible organic herbs wherever it is possible. Or when I use extract, I see that all water contamination, soil contamination has been taken care and has removed, and proper clean formulation is there with me. Apart from what Dr. Nimbalkar sir said, yes, we advise patient to have proper diet and exercise, but this care has to be taken. That's what I want to say.
Thank you for sharing that, Dr. Nitin. We know that milk requires that you have enough digestive fire to digest it. And in addition, if you have all those other things, the hormones and the bad karma from separating a mother from its baby and then taking the milk and not giving it to the calf first, we know that that's not good. So thank you for that opinion. Manoj, is there another question?
Oh, sure. Pallavi, so the Patankar, could you please unmute your mic and ask your question?
Thank you, Dr. Manoj. Thank you so much. I just wanted to quickly ask, I'm Dr. Pallavi, about curcumin to Dr. Nitin and Dr. Ranjit also. Ginger, peppermint, and curcumin both all are Ushna Virya. So, how far is it advisable to give to people?
Yeah, so what is both are Ushna? Yes, we know that, and that's why we identify the personality of the person only by curcumin and this ginger. I also use bhallataka, which is very Ushna. But if it is properly purified, and you have identified, so we advise patient that yes, there are some side effects which can occur, and we know the antidotes also. And most important, we start slow. We don't give one dose, the full dose. We start with the very slow dose and we titrate. So Shanai, what is written in Ayurveda, you titrate the dosages slowly. So most of them, now one has to understand the side effects. It is organotoxic side effects I have not seen, because whatever formulation we are using, what side effects we see, they are just like a gas bloating or gas or little bit of indigestion managed. Yeah.
So, thank you, sir.
Yeah, thank you.
Thank you, Dr. Pallavi.
Thanks, Baswati.
We'll take one last question from Dr. Raghuraman. If you could unmute your mic and ask your question.
Dr. Raghuraman, do you want to unmute?
Yes, please.
Okay.
Yes. Just a final question before we end the session. Because now we are talking about integration of the whole world and all the systems of medicine. Well, how do you propose to bring all the branches of medicine together, especially in pharmacology, in terms of proper randomized trials? And in what way can we get specific data?
Yeah, so
rather than case trials, because case trials are flawed by their performance. It may work for one person, especially with Vata Pitta Kapha dosh, and it may not work for another person. So how can we integrate the two? For that, you will have to integrate and do it with the, combat it with the allopathic medicine, side by side. You cannot do it independently. That's not possible. At some point of time, you will not get permission for this. So in order for this great science to move forward, how do you propose to do this integration of the two for the great future of mankind and for everybody?
So thank you, sir. The very valid question. What I feel like I have understood, I have learned, Dr. Bhattacharya has learned, Dr. Nimbalkar has learned the modern language, okay, to understand cancer. Similarly, what we request to all modern doctors, like Dr. Bhattacharya, she knows very well about Ayurveda. So if both of us, allopathic doctors and Ayurveda doctor, they want to work together, we should know our science. You should know Vata Pitta Kapha. We are ready to explain you from the genetic point of view. What is Vata, Pitta and Kapha, how we can also involve a genetic scientist in that. So first, if these basic principles are clear, then we can work together. Second thing, decide the goal of Ayurveda. Let us start with the onco prevention. Give chemotherapy, give surgery, give radiation, give oncotherapy. We know that this patient is high proliferative. Ovarian cancer, they are known to relapse. They are known to relapse very quickly. Or triple negative breast cancer, we know that they are going to have a bad prognosis. So identify such cases, complete your chemotherapy, surgery, radiation. Thereafter, immediately you give these patients, Ayurveda treatment based on the protocols of the Ayurveda. Let Dr. Manoj Nimbalkar or any other Ayurveda doctor, identify the patient's personality, decide the drug, and give it. But it cannot be a single drug. Why all clinical trials are failing? Let me put this word: only curcumin, only ashwagandha will not work. It has to be, the combination, proper combination of, herb. Let us use what is written in the text. Let not be use a formula developed by Dr. Kochar or Nimbalkar or anyone else. Let us use whatever is written in the text and use that. That's it. So that will be first, understand Ayurveda language, learn that, agree that. If you don't agree, let us discuss on that. Second thing, have Ayurveda as an onco-preventive treatment. And that will be the fourth pillar of, cancer treatment, and see the outcome. Let us have the data for 1 year, 2 years, those who have treated with Ayurveda and those who have not treated. Because to get the ethics committee permission is not possible. You cannot do that. Double-blind placebo control study is out of question. So that is the way we should. And once it is proven, then we can go further for the stage 2 or stage 3 clinical trial.
Dr. Raghuram, you have a comment on that?
Yes, it's very much possible to conduct studies on oncoprevention. And for that, you don't need an ethics committee, because once the cure is over, that can be randomized and you can do it in a hospital. And I think there is so much of scope in the future, both in terms of prevention as well as in terms of preventing side effects. And like Dr. Bhattacharya said, in terms of coordinating on the molecular level.
Yeah, well, I have a comment on that, this whole approach. I do think that in order to bring it to mainstream medicine in the United States, for example, trial data is important. Case studies are limited, as you were saying, for many reasons. But to do that, it costs a lot of money, right? So one approach is creating patient registries, speaking the same language as you have with stage diagnosis, stage pathology, molecular pathology, and then also approaching it with the treatments conventionally that were treated, and then also the Ayurvedic treatments that were approached, probably using some sort of electronic medical record to create a registry of what you've done and showing the outcomes, following the same guidelines throughout hospitals in India, and showing us the approach and how it's working as a long-term approach. Now that we have artificial intelligence, we could gather that data in a more cohesive manner and try to interpret it in a deep learning kind of approach to see what these approaches have led to as far as outcomes. That's one way of trying to approach this complex problem without the use of randomized clinical trials, which probably are very difficult to do.
Manoj, there are several patient registries in India. Āyurveda, through the CCRAS, through several of the institutions. I had a slide that had 25 of the big players of Ayurveda and cancer in India, but that's not directly about the mechanism of action of Ayurveda, so we didn't go down that pathway. But there are people that are trying to do it. The problem is that you need training on how to enter the patients into the registries. You just need to says these are the fields to fill out. These are the things you need to have. If you don't have these that are absolutely necessary, then the registry entry isn't going to happen. And if you have these and then a few of these, but not all of them, that's okay. And if you have all of it, great. But to educate people on how to fill out those patient registries is really important. And then I think we can start accumulating the data. I've been trying to do this for about 8 or 10 years, and all those registries have failed so far. I think, Nitin, I don't think there's a patient registry at Tata that's working right now for Ayurveda and cancer. Is there? Yeah.
Right now, no.
So, yeah, I mean, I just think that that might be an approach to consider. Yes, of course, you have to speak the same language and use the same data points, and there is some challenge in filling out those data sheets, and that does take some workload in inputting the data from the get-go. But that's a means that probably more futuristic in thinking about solutions.
I do want to say that Dr. Ranjit didn't talk about this because he was afraid of conflict of interest, but the company that he's consulting for is run by a tech company, and they're going to not only do the onco care through the journey and have him lead a team of people around the journey of patients with cancer, but they're going to be doing it online, so they're going to be recording data, and those data, you know, if he sees 100 patients, that's 100 patients in a kind of pseudo-cancer
Yes.
registry. So Dr. Ranjit is going to be running that, and he's also has a postgraduate diploma in clinical research. So he's very excited to gather those data. And we've been talking about, you know, how to run those studies, how to gather the data and make sure that they work. And since Dr. Ranjit is doing this comprehensive, allopathy is there, but then the Ayurveda is there, and this is kind of a furry animal because it's not as clean according to the oncologists, right? It's got a lot of parameters, and Ayurveda also believes that as you heal, you change the medicine. So it's not that you give one medicine for this period of time for the next, you know, like a blood pressure medicine for the rest of your life, right? It changes. So a lot of those parameters are going to have to be dynamic, but I think Dr. Ranjit, you are planning to have a kind of a registry or collection of data of your patients, right? Oh,
Yes, yes. So let me share my screen just a minute.
So one other point is that it seems like not all Ayurvedic protocols are the same, right? So each practitioner has a variance in how they manage patients, which creates some difficulty with interpreting the data.
Correct. And these different approaches make it difficult. I think he's scrolling up. He's going to show us. Okay, there we go.
So now in cancer, what happens? Which organ is important? Then which tissue in that organ is also important. So breast cancer doesn't mean all breast cancers are same. So it can be a ductal carcinoma or a lobular carcinoma or a carcinoma of the nipple, or it can be a phyllodes tumor. Many subtypes are there. So that is a different issue. But here, phase-wise approach means we try to identify cases in which phase the cancer is currently. So the newly diagnosed case means when the patient, just the diagnosis, biopsy has come and patient has been diagnosed, and no further treatment is yet given to the patient. Obviously, it will be a small living phase, but yes, it is there. So in those type of conditions, we'll gather the data, and our aim will be care of inflammation due to the tumor or concerning symptoms, especially psychological support, until the patient undergoes conventional treatment. So this type of data we are looking forward to collect. Then post-operative, once the tumor has been operated, so in that concern, the promote wound healing or minimize the complications, and overall health care will be our aim in this type of case. Then again, during conventional treatments, we have talked about a lot about it. So minimize their untoward effects and make these treatments tolerable and increase their efficacy. So that will be our aim. Then during remission, obviously we have talked a lot, improve immunity, quality of life, and prevent or prolong recurrence. During progression, again, patient might need again some chemotherapy, immunotherapy. So it will be similar to the phase 3. But in addition, symptom relief is also important because of this progressive phase. The cancer has spread to some different organs, and there can be some symptom related to that. So our treatments or the adjuvant treatments will help for that also. During palliation, all those things, but basic physiological functions like bowel, micturition, appetite, sleep, we need to take care along with the here control or reversal of the disease is beyond possibility. So we are just to palliate. In our language, we call it as a yak care. So you have to just maintain that condition and make the life of that particular person easy. So these additional things we are looking forward to offer through Ayurveda. And prevention, obviously, and especially in a high risk individual. So if she is a lady, but early menarche or late menopause or late pregnancy or no breastfeeding, so all the or genetic predisposition, everything will come under high risk individual. So such type of patients or females or if we offer our Ayurveda treatment to them and follow them, automatically they will get followed for say 5 years, 10 years, and automatically that data can be created over a period of time down the line, and will support immunity, especially in this such conditions. And we are looking forward to generate this type of data. So which organ, which tissue, and in addition, which phase the patient was there, and obviously this phase number 7, phase number 4, and phase number 3, we are very much looking forward. Others are short-lived phases, and let us see what happens. But 3, 4, and 7, I think those are our home grounds.
Can you show the 7?
Pardon?
Can you show 7 again?
Prevention.
Yes.
So especially
so I say, yeah, I say the approach that should, that would probably bring the most or most help is number 4, which is decrease in remission, which you're not conflicted by conventional treatments, and a survivorship phase where where we do need, I guess there's a lot more survivors in cancer care across the world, and a space that you're not prevented by conventional treatments. Another thing that I would say is that in order to, like any science, reproducibility is one of the most important factors. How do you reproduce this in other patients? So creating protocols that are consistent based on certain parameters is probably would be most useful in trying to support the science behind Ayurveda.
Well, there is that consistent parameters, but if you use the PICO system, sometimes the consistency is about the symptoms. Sometimes it's about the patient's particular digestive fire. That's what we use, right? If people
but that's where the consistency, I would say that's where it also makes it difficult. Right?
It's consistent in Ayurveda because there are definite signs and symptoms of the strength of the digestive fire or the strength of the mind. But those are not parameters that are considered to be important in conventional biomedicine. In Ayurveda, there's a lot of stuff that goes just around what is the Agni in their gut. Oh, then you can give this medicine. If the Agni is not good, then give this medicine first and get the Agni up. Or if the Agni is not going to be good because the person is just very weak, then don't give this medicine. Don't give the ashwagandha and shilajit because they won't be able to digest it and it'll just be undigested toxin in their gut. Give them instead a watered down version of something that they can digest and slowly kindle the Agni up. And then when it reaches that threshold, then you can try a half dose or a quarter dose. And that is the parameter, I would say, that is the consistent thing in most diseases, is the Agni. I think Dr. Nitin and Dr. Ranjit, if you agree with me on that, right? That's a consistent parameter that we use. But it's not a parameter that is recognized in allopathic, biomedical care. And the signs and symptoms that we look for are very, very simple. Appetite, bowel movement consistency, cravings that they have, their sleep, their emotional lability versus steadiness, the fatigue level they have. These are the A, B, C, D, E, F, and we use them consistently to evaluate our patient's Agni. And you can design studies around that if you believe that these constitutional symptoms are important. But if you don't in my biomedicine, because you need to see their LFTs or you need to see their, some other parameter, then it's going to be hard to design a study because there's not a philosophical alignment that the digestive fire, the Jataragni as it's called, is quintessential for life. It is the thing that gives people that. It's like the storehouse of energy.
I guess what I'm saying is that fair, but you have to be able to quantify what you're saying. So that, if you quantify Agni, how do you quantify it? How would I reproduce what you're doing is a question. And really, and how much dose, how much of the medication, and, when you say watered down, what does that mean? Those are the questions that I guess are implicit in reproducibility, right? I mean, would you agree? So, so that we all speak the same language.
Yeah, and I think that's where we come up with a scale or a set of scales that are
Yes.
already SF36, quality of life. Can we use that? Is it quantifiable enough? Visual analog scale, it's this classic pain scale, but is that quantifiable enough? It's a very qualitative, quantitative kind of.
But it's used. It's used, and it's used universally. So even the DSM, you could argue, in psychiatry, it's more of a qualitative, quantitative, but we have to be able to speak the same language in order to reproduce it. I guess.
And we do have scales like that many of the Ayurvedic researchers who have learned, Ayurvedic physicians who have learned clinical research have learned about which scales to use. Dr. Ranjit and I, we were together in December and we were discussing different scales that you can use for clinical research and which ones are consistent. And then there are cultural differences, right? There are certain scales that work in certain populations, but like for mental health, is the Kuro scale better? Is the Beck depression inventory better, which is very long and gives you depression just by taking it, or the Prime MD 8, right? I mean, which is the better parameter to use? Not parameter, valuation instrument. And I think
but whatever it is, as long as you use that consistently in the trials, then others could reproduce that same scale in evaluating their patients. That's the point. Dr. Pallavi, if you want to interject.
I just want to comment. In Ayurveda, a very beautiful example is given about home havan. Home havan is, the religious fire. You keep pouring a spoon of ghee. Ghee is clarified butter on the Agni, and it pradips. It ignites. Similarly, they have given this example that even our Jataragni is also the same way. A little amount of pure ghee, cow's ghee, which is made at home, it really ignites your Jataragni. You have to use it very little by little. If you pour too much of ghee, it will shut down the Agni. So it's a very beautiful example given that in home and havan, how they put spoon by spoon, they put the ghee, and how you see that fire igniting. I'm sure Dr. Nitin, he may not agree, but Ranjit and Bhaswati may agree to this.
Well, I just make sure I use a very good ghee. I have gone to the factories and checked, and in the US I have, in France, in all the places I practice, in India, I have sources of cultured ghee, which means milk that's made into yogurt that is then turned and made into butter, and then that and made into ghee. And if it doesn't yogurt process, the bacteria do not transform the milk, and oftentimes they eliminate some of the problems. Not all of it, of course, karmically that you can't, but if you use cultured ghee in America, I find huge benefits from it. And I also start with a drop by drop approach. I don't tell people to start with a teaspoon, and when they start ghee is one of the only things that can repair the gut. It is excellent for wound healing, internal and external, and it lights, as you said, the Jataragni. So I use ghee because of its unique place in the Ayurvedic Shastras, but also in my clinical practice. What I've seen, I see IBS patients heal completely using ghee in the 3rd or 4th stage of treatment. In cancer patients, I give 1 drop of ghee as they heal, and I find that it really does repair the gut from some of the chemotherapy and the gastric insult that the chemotherapy has caused.
I agree.
You have to use it well, and I don't disagree with Dr. Nitin because I think the points he's making are true as well. So thank you for bringing up, Dr. Pallavi.
Thank you.
Okay.
Thank you so much.
Now we're 2 hours in, so I'm going to we're going to have to, I think, close out, but with much respect and thanks to Dr. Nimbalkar, Dr. Kochar, Dr. Bhattacharya for putting this discussion together, and Dr. Bhattacharya especially for gathering a team of experts in trying to discuss this very important topic of Ayurveda and cancer care. Last words, if you have any last words for each of the speakers. If you'd like to say something, please do.
Yeah, first of all, thanks for this wonderful initiative. Let this be a beginning. Let us start, integrate. We know now each other's thought process. We are working on the same platform for the benefit of the mankind. So let us go ahead and start again. That's it.
Thank you. Dr. Nimal.
Yeah, thank you, Dr. Manoj, for this wonderful opportunity, and of course, Dr. Baswati for this opportunity. We also really enjoyed a lot, and questions were extremely nice. When the questions are good, then there is always a good satisfaction for a speaker that yes, the audience is thinking over whatever we are telling. It may not be right, we are not God, so 100% right may not be there. So if they point out some shortcomings in our presentation, that's again a good learning. In Ayurveda says that there are 3 types of learning. One is studying, another is teaching. Teaching is a good learning process, and having a discussion with your colleagues. So these types of 3 types of things they have described, and I think all 3 we also enjoyed, because I got to learn a lot from Dr. Nitin, Dr. Baswati, and all the colleagues who asked the questions. There were some thought provocation in my mind also, and I will think over again, and it's always a good learning. So thank you for this opportunity as well.
Thank you. Dr. Bhattacharya, would you like to conclude, and thank you again?
Thanks, Dr. Manoj. I have been talking with you about this session, and I'm glad that we finally did get to plan it. We were a little concerned because it doesn't have the kinds of evidence that many conventional therapies do, but this is a group of integrative oncology, and I hope that especially the members of the IOWG who are oncologists got something out of it. There are a lot of questions coming to me privately about brand names and medicines and all this. You have the email addresses of all 4 of us. Please write to us individually. Everyone has their own preferences, and we all work with individual patients. I am happy to do another series, either through my own institute. You all know I'm at Cornell, and I'm happy to have Manoj, maybe coordinate something through the IOWG, through our chat groups that we have already. But I'm not going to answer these questions that are, give me the brand name so you can just go on your own and do stuff. You really need to have guidance especially when you're going to use bhasmas or some of the medicines. And so I thank everyone for their questions and for the great discussion we had here. There is a lot of interest, so this is great. And Manoj, thank you. Thank you for having us.
You're welcome. Pleasure.
The poster that you put together. Namaste.
Pleasure, and thank you again. Our next meeting, our grand rounds will be with Dr. Nalini Chilkoff, an international expert in integrative care on cognitive impairment and accelerated brain aging, the insult of cancer and cancer treatments on the brain. All of you are welcome to join. The registration is listed. Whoever's here will be emailed regarding this meeting. It'll be on April 27th at 1 p.m. Eastern Standard Time. That's in India. That'll probably be around 10 p.m. Everywhere else, check your timings. Thank you so much, everyone, for joining us. You had over 150 people maintain their attention for 2 hours. So thank you so much again for spending your time. Good night, everybody. Good morning. Good day.